Today's webinar will be on K01 Apple Health Modified Adjusted Gross Income Long-Term Care Program. We will be reviewing these topics during this presentation: a program overview, some K01 common terms, K01 other requirements, the application process, ongoing eligibility, common scenarios, managed care, fee-for-service, and behavioral health services only, and additional resources. Overview. K01 refers to Modified Adjusted Gross Income Long-Term Care Medical for individuals who are not otherwise eligible for free MAGI-based Washington Apple Health Medicaid coverage, such as N13, N31, through Washington's Health Benefit Exchange at wahealthplanfinder.org, or classic Washington Apple Health coverage, such as SO1 or SO2, based on being age, blind, disabled, or in foster care. In ACES, the MAGI-based long-term care program is identified as a medical coverage group K01. In Provider 1, the most common RAC code for K01 is 1052. K01 uses institutional rules in determining Medicaid eligibility. Institutional rules allow us to look at just the individual's income. This means HCA can find the individuals eligible for Apple Health coverage who might otherwise be denied if we had to look at the entire household's income. Due to these rules, we also ask if the child/youth is expected to be hospitalized for 30 days or longer. Reminder: individuals who are receiving Apple Health coverage through a MAGI or Classic program do not need to apply for K01. Categorically needy coverage, CN, or medically needy coverage, MN, already includes a long-term care benefit. Individuals who have active coverage do not need to complete a separate application for K01 coverage. Terms. Medical institutions must be licensed under state law. They must provide for the medical needs of the patient on an ongoing basis. Hospice centers must be licensed and Medicare certified. Nursing facilities licensed to provide skilled nursing care may be nursing homes or nursing facilities within a hospital. Eastern or Western state hospitals are public institutions, but could also be considered a psychiatric hospital or an IMD. IMDs may be a hospital ward primarily engaged in psychiatric treatment. ICF, IID facilities in Washington State include Fircrest School, Lakeland Village, and Rainier School. Washington has 4 CLIP inpatient facilities: Child Study and Treatment Center in Lakewood, Two Rivers Landing in Yakima, Tamarack Center in Spokane, and Pearl Youth Residence in Tacoma. Requirements. K01 requirements. Washington covers children up to age 19 regardless of citizenship status under free MAGI-based Apple Health coverage. This includes undocumented children. If a child is not eligible for free Apple Health coverage because of their family income, then they may meet citizenship or immigration status rules for K01. They must reside or expect to reside in a facility for 30 days or longer. This is why we request facility or referral staff to provide a statement regarding treatment duration with their initial email requesting coverage. If the individual came here from another state solely to obtain treatment, they are not eligible, as they are not considered Washington residents. For example, children whose families reside in Alaska, Hawaii, Idaho, or Oregon are not eligible for Apple Health. K01 may be appropriate for any individual up to age 64 if they are in the hospital for a medical condition. K01 is only appropriate for an individual up to age 21 if they are in a psychiatric facility. Other funding sources are used for long-term psychiatric hospitalizations of adults. Children, regardless of immigration status, may be eligible up to age 19. After age 19, children who do not meet immigration citizenship status are only eligible for Apple Health if they meet alien emergency medical criteria. There is also a limit on the number of available nursing home beds for these individuals and would require approval from the Department of Social and Health Services, Aging and Long-Term Care Services Administration, also known as ALTSA. In addition to the K01 requirements on the previous slide, individuals must meet the following requirements by age. From birth to age 18, the income requirement for K01 is equal to or lesser than 210% of the federal poverty level. The facility requirement for this age group can be either a medical or psychiatric facility. From age 19 through 20, the income requirement is equal to or lesser than 133% of the federal poverty level. The facility requirement for this age group can be either medical or psychiatric facility. Another requirement is the individual cannot be on Medicare. From age 21 through age 64, the income requirement is equal to or lesser than 133% of the federal poverty level. The facility requirement must be a medical facility only. Another requirement for this age group is the individual cannot be on Medicare. Parenting adult. The income requirement follows the N01 income standard. The facility requirement must be a medical facility only. Application process. Application process, step 1. The Healthcare Authority prefers families to apply online at www.wahealthplanfinder.org. If assistance with applying is needed, families or the individual can call 1-855-923-4633. A real-time eligibility decision can be received by applying online. Individuals can also download a mobile app for your phone. Completed K01 applications may also be faxed to our email address, or a paper copy can be mailed. It is important that the application is completed in full and includes all household members, all income, and healthcare coverage. If the admission was prior to the month of application, retro coverage can be requested up to 3 months prior to the application date. Facility staff may complete an application on behalf of a resident. Facility staff should submit a signed release from the client or the client's representative if they want to discuss details about the client's eligibility. The client may also list the agency staff person on their application as an authorized representative. If the application is approved for MAGI-based coverage, K01 is not necessary and no additional steps are needed. Application process, step 2. If MAGI-based coverage is denied, families or the facility should send an email with the individual's first and last name, the HPF application number, date of admission, date of discharge if known, and if the individual is expected to reside in the institution for 30 days or longer. There is no need to wait 30 days to apply if it is expected that the individual will be inpatient for at least 30 days. HCA recommends applying within the month of admission if a need for coverage is identified and it is likely the individual will be inpatient for 30 days or longer. If an application is submitted after discharge and the individual was not hospitalized for 30 days or longer, they are not eligible for Apple Health using long-term care rules. Ongoing eligibility. K01 ongoing eligibility. Once a child's eligible for Apple Health coverage, they remain eligible for 12 months as long as they remain a Washington State resident and are under the age 19. It is very important that healthcare authority is notified about discharge dates or dates the client transfers from facility to facility. Send an email to K01app@hca.wa.gov with the discharge dates and discharge address information, including another facility. An individual is only eligible for K01 while they are institutionalized. If discharged prior to the end of the 12-month period, the child will be open on free MAGI-based Apple Health coverage. If the child is under the age of 6 and discharges from a facility and the K01 program is closed, the child will remain eligible for the free Apple Health for Kids program through the end of their 6th birthday month. K01 discharge planning. In advance of the discharge, facilities will need to send an email to K01app@hca.wa.gov with the discharge dates, managed care plan preferences if known. This ensures the child is open and enrolled in appropriate Medicaid program and MCP as of the first of the following month. HCA should also be notified when the child is continuing care at a different facility. HCA would need discharge dates and the facility name the child is transferring from, admit dates, and the facility name the child is transferring to. Ongoing eligibility waivers. Some children are discharged to home but may have significant ongoing care needs. If ineligible for MAGI-based coverage beyond the initial 12-month certification, they will need to apply for long-term care under a waiver. Eligibility requires a functional needs assessment by Developmental Disabilities Administration (DDA) intake. The family will also need to complete a long-term care application, and the child may need a disability determination. K01 Common Scenarios. Scenario 1. Child is admitted to the hospital on January 1st and remains hospitalized. Family applies for coverage through WashingtonHealthPlanFinder.org on February 20th and is denied coverage. What do you do? Send an email to K01app@hca.wa.gov and include the child's first and last name, HPF application number, date of admission, etc. Because the admission is in the month prior to the application, include a request for January coverage in your email. HCA will determine eligibility for K01 back to the date of admission. To ensure HCA staff can determine eligibility for the month of admission, it is best to apply within the month or within 3 months of the admission date. For HCA to discuss eligibility outcomes with the facility, a signed release from the parent is needed. Scenario 2. Child hospitalized on January 1st and remains hospitalized. Child is approved for SSI effective February 1st. What are the next steps? The family will need to apply for MAGI-based coverage through www.wahealthplanfinder.org. The application will deny regardless of family's income. Send an email to K01app@hca.wa.gov and include the child's first and last name, HPF application number, date of admission, etc. HCA will determine eligibility for K01 back to the date of admission. When a child is approved for SSI, their Medicaid eligibility begins the first of the month of approval. In this scenario, that leaves the child uncovered for the month of January, thus the need for an application to be filed even though the child has current coverage. It is really important that the family applies within 3 months of admission, request long-term care, and indicate there are outstanding medical bills if applicable. HCA will manage coverage for any child who was approved for K01 during the certification period, including retroactive eligibility. Children who are active on an SSI-related program will need to contact the Community Services Division, CSD, at 877-501-2233 as this coverage is considered classic Medicaid and is managed by CSD. If the SSI medical has already closed and the child is still hospitalized, the family should submit an application through the www.wahealthplanfinder.org and follow the MAGI application process. Scenario 3. A child is hospitalized on January 1st and remains hospitalized. The child is approved for K01 effective January 1st through December 31st, 12 months. On November 1st, a renewal form is sent to the authorized representative to complete and submit. What are the next steps? If the child is still hospitalized, send an email with the renewal to K01app@hca.wa.gov. Include a statement that the child remains hospitalized, the child's first and last name, and the HPF application number. If the child has been discharged home, send an email with the completed renewal to K01app@hca.wa.gov. Include the child's first and last name, HPF application number, date of admission, date of discharge. HCA staff will review the changes and determine eligibility for the appropriate coverage going forward. Scenario 4. A child is admitted to a CLIP facility on January 1st and remains institutionalized. The child is approved for K01 effective January 1st. How are bills paid? As of January 1st, the child is not enrolled in a managed care program. Rather, they are considered fee-for-service. The reason for this is the CLIP facility is considered an IMD. While residing in an IMD, individuals cannot be enrolled in managed care if the individual is 21 years old or younger or over the age of 65. Bills for services will need to be submitted to Provider 1 for payment while the child is fee-for-service. Managed Care, FFS, and BSHO enrollment. Apple Health Managed Care. Individuals can choose from any of the available plans that serve their area when they enroll in Apple Health. Not all plans are available in all areas. All Apple Health plans cover the same basic services. Each health plan has its own network of providers, hospitals, and pharmacies. It is important to verify with the health plan that your preferred providers are in the plan's network. On this screen are the managed care plans and contact information. What is managed care? Managed care plans coordinate physical health, mental health, and substance use disorder treatment services under one health plan. Apple Health pays a managed care plan a monthly premium for coverage. Individuals can choose or can be auto-assigned a plan the day they become eligible. The managed care enrollment is backdated to the beginning of the current month. Changes to the managed care plan can be made at any time and usually take effect the month following when the changes were made, unless the request was made in the last 2 business days of the current month, in which the changes would not be effective the first of the month after the following month. K01 eligible children will enroll in a managed care plan with some exceptions. AIAN individuals are not auto-enrolled in FIMC. They are auto-enrolled into fee-for-service and may opt into a behavioral health services only plan. Youth residing in an IMD or psychiatric facility, including a CLIP facility, will not be enrolled in managed care but will be considered for fee-for-service and may opt into a BHSO plan. What is Apple Health fee-for-service? Apple Health services covered without a managed care plan, also called fee-for-service. Apple Health pays providers directly for each service they do using the Provider 1 services card. What is behavioral health services only coverage? Clients who are found eligible for Apple Health coverage under fee-for-service can select a behavioral health services only plan. HCA staff will automatically enroll clients into a BHSO plan if they do not select one. Resources. Some resources include the Apple Health Eligibility Manual for K01 coverage, Washington Health Benefit Exchange Customer Service Phone Number, HCBS Waiver Program Request, Home and Community Services Office Locator. Thank you, and we will now allow time for your questions.